Hi, today I'm going to be practicing the skills of the glucometer and drawing up medication and mixing it, and then also giving an injection subcutaneously. I have checked my orders and I am ready to approach Miss Ivy with our process. Okay. Knock knock.
Hi.
Hi Miss Ivy. My name is Lauren.
Hi, Lauren.
I'm going to be your nurse today. Bright lights, Gizmo. Let me see. Name and date of birth, please.
Ivy Armstrong, March 9, 1964.
And are you allergic to anything?
Latex.
I see that on your wristband. That's great.
Okay.
Let me grab some wipes. I'm going to wipe down this table. And I'm going to give you some privacy with this curtain.
Okay.
Today, they have asked me to make sure that we give you a glucose test before your lunch tray comes,
Okay.
and then appropriate insulin.
Okay.
Has anyone talked to you about all of this yet?
Well, my doctor has mentioned to me
Okay.
like yesterday, but I kind of like forgot what it is.
Okay, so let's talk about it before we do it. Right now, I am going to be using this glucometer to check your blood sugar level. And then after I find out what your actual glucose reading is, we are going to then decide how much insulin you will get.
Okay.
And you get these blood sugar checks with your breakfast, lunch, and dinner and before bedtime because you are diabetic.
Okay.
We have to keep your blood sugar under control.
Okay. Sounds
So-
perfect.
I'm going to go ahead and turn on my glucometer.
Okay.
Glucometer is on. We're going to go ahead and give it the operator ID.
Okay.
Beep. And tell it we're going to do a patient test. Our patient ID is here, but in real life it would be on our patient wristband. The next step is to scan the strip lots, make sure your strip lots are not expired, and that they're within the appropriate date of being opened. Let's see. Okay. Now we're ready to put the strip in. Okay. And my strip is in. It's thinking. While it thinks, I'm going to grab my analog squishy pad. And we're gonna do these things. Okay, Miss Ivy, which finger do you want me to use?
The index finger, the right one.
The index finger, the right one? Okay, so I'm gonna clean this one in small circles going out. Finger is clean. I'm gonna twist this off. Throw that away. And we're going to poke the finger in 1, 2, 3.
Ouch.
Poke. Okay, this we're going to keep to put in a sharp spin. On Miss Ivy's finger, we have some blood.
Okay.
That blood is there. We're going to wipe it away because there's alcohol on the skin and that can cause an error in our measurement. So the second drop of blood that we have here is what we want. Take the glucometer, hold it up, use the capillary action of the machine, and it's going to tell us a reading. We wipe away this blood and hold some pressure on it so it stops bleeding. Miss Ivy, your blood sugar is 110. We are going to say, okay, RNMD notified, check mark. Take this and throw it away in the trash can. Make sure we turn this off. Close all that up. Throw this away in the sharps container because it is sharp. Do not stick yourself. While I'm over here, I'm going to say thank you, Miss Ivy. I'm going to go draw up the appropriate amount of insulin for a blood sugar of 110. You have your call light if you need me. I'll be right back with your medication.
Okay. You're great.
So, now we're going to come over here and get our medication. I have gotten the medication from the Pyxis system. It was at that point that I did my first med check, so I know that I have the right medication for the right patient. Now, we're going to go ahead and draw up the insulin, mixed dosage. So, I have our syringe, I have my NPH, and my regular. We're going to take an alcohol prep pad, and we're going to clean for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. We have clean vials. So my orders say I'm to give her 17 units of NPH and 7 units of regular. Here's my syringe. I'm going to uncap it safely. Then I am going to set this here so I can scoop it up later. I need 17 units of air for the NPH. Oh, friend, do you see here? That's 17 units? Okay. 17 units of air going in. N. And now 7 units of air. Friend, do you see that 7 units of air?
Yep.
Going into R. Now we're going to flip our vial to where I can see that, yes, that's in there in solution.
Okay.
I need 7. I have put the air in.
Mm-hmm.
I'm going to pull back, and we're going to get 7 units of regular. And be very careful to be accurate, because once it's mixed, you can't push anything back in. 7 plus 17 is 24. Friend, is that 24?
Yep. Mm-hmm.
Okay. Now, this cap has rolled in a different direction, and I am annoyed. But we still can scoop it safely and recap it so I can carry it to Miss Ivy's bedside. All right. Alcohol prep pads are coming with me. I will take off my gloves when I re-enter Miss Ivy's room. Knock, knock, Miss Ivy.
Hi.
I'm going to have hand hygiene, and I'm going to put on a new pair of gloves. But for purposes of succinctness, we're not going to do that. Name and date of birth, Miss Ivy.
Ivy Armstrong, March 9, 1964.
Okay, Miss Ivy, I'm scanning it into the computer. I'm glad you are who you say you are. Are you allergic to anything still?
Yep. Latex.
Still allergic to latex. Okay, so Miss Ivy, today I have here 24 units of insulin for you because you are diabetic and you do need your insulin administered before you eat your meal. 17 of these units are NPH, 7 of them are regular. We're going to be injecting this subcutaneously. I would like to use your abdomen. Is that okay with you?
Yep. Mm-hmm.
Okay. Do you have any questions before I do this?
I think I'm good.
Okay, you think you're good. Let me uncover your belly real quick. I'm going to take a look. And then I'm going to make sure that there's nothing under the skin that I should worry about. All right. Then I'm going to clean the area. I will also mention that I did scan your medication in the computer, so that makes it my 3rd medicine check to make sure that we have the right patient, right medicine, right dose, right route, all of that. Okay, Miss Ivy, are you ready?
Yep.
I'm going to pinch, stab, release, inject, pull back. Thank you, Miss Ivy.
Oh, thank you.
I am not going to recap this. I'm just going to cover up your belly real quick and walk around the bed to put this in the sharps container. In the sharps container. Okay. I will be back to check on you in a little bit just to make sure that there's no reaction at that injection site and that there's nothing we need to worry about there. Do you need anything else, Miss Ivy?
I think I'm good.
Okay, then you have your call light if you need me. Enjoy your Star Wars.
Thank you.
Hopefully they'll be by with your lunch soon.